Good afternoon, everybody. My name is Kevin Lopez. I'm on Bridgeport City Council, coming to you live today from Bridgeport, Texas. Welcome to Bridgeport Community Update. It is May 6th, 2020. I'd like to thank all of you for coming and viewing the show today. The intent for Bridgeport Community Update is to provide up-to-date and accurate information on information regarding COVID-19, and then provide resources that are available to the community through various organizations, providing that information to them. And then plus, we also like to promote local businesses in our community during the business of the day portion of the show. So today's going to be an outstanding show. Today's guests are Jason Wren, who has the distinction of being a fellow of American College of Healthcare Executives, and he's also the president and CEO of Wise Health Systems here in Wise County and Tarrant County and Denton County as well. But he is the president and CEO of our healthcare system in the county. And the business of the day is Stefany Jones. She's the owner of Halsell Street Boutique and Resale here in Bridgeport, Texas, down on, as the name implies, Halsell Street. But anyways, I'd like to thank our guests for coming on today. This is also the time where I typically give the COVID-19 numbers, and I'll bring those up real quick for y'all. There they are. And today, as of yesterday evening at 10:05 p.m., the number of tests administered in total have been 1,065. There are 28 positive, 917 negative, 90 pending, 30 inconclusive. There are 4 active cases, 22 have recovered, and unfortunately there have been 2 that have expired. And obviously our prayers go out to those families and to those who are currently going through active cases right now, and for a speedy recovery. The county has a positive test ratio of 2.63%. The state positive test ratio is 7.81. The county has the percent that we have tested is 1.54% of the population of Wise County, and then the state's percentage tested is 1.45%. And so those are our numbers as of May 5th, 2020 at 10:05 p.m. And so again, I think a lot of the numbers are attributed to a lot of people heeding the warnings and following the guidelines of social distancing, washing hands, and wearing masks. We went shopping today and saw a lot of people wearing masks, and that's really good because we're not out of the woods yet as far as regarding COVID-19. And so we still have to follow those guidelines and the suggestions from the CDC and other federal, state, and local guidelines. And so, but our first guest today, as I said, is Jason Wren. He is the he's the CEO and president of Wise Health System. And so we'll bring up Jason right now. There he is.
Hello, Kevin.
Hello, Jason. How are you doing today?
I'm good. Thank you for having me.
Well, thank you for coming on. I know a lot of folks would be eager to hear what you have to say, being the president and CEO of Wise Health System. And so I know you'll have a lot of great information for them. For the folks that may not know, can you tell us what your role is at Wise Health System?
Yeah, I've been with the organization a little over 7 years now, and I'm an attorney by background. I started out with the organization as its general counsel for the first few years and moved into the president and CEO role back in April of 2017. So a little over 3 years in my current role and about 7 with the organization as a whole.
Yeah, that's hang on, I'm having some technical issues here. Well, can you tell the viewers how things have been going at Wise Health System and how y'all have adjusted as our county's healthcare system, I guess, through all this?
Sure. Well, it is in that 3 years as CEO and 7 years as general counsel. This has certainly been the most unique and challenging time in my tenure here, probably in my career as a whole. It is. We talked a lot early on when this started about the importance as an organization and as leaders of the organization we use the phrase pivot but don't panic. And so there's been a lot of pivoting that has gone on within Wise Health System over the last 6 weeks. I would say, let me back up even before that. There had been some planning sessions to try to, understand and prepare for COVID starting as late January. This is a crisis that is, from a protocol standpoint, it's not that different from other types of disasters that may occur. From the standpoint of, we have an emergency management protocol and process in place in the hospital. We review those processes regularly. We run tests on them. And, the way we would handle a disaster is no different than whether it's a tornado or a virus pandemic like we have here as far as our processes go. So, we started having some conversations in late January, but it was really that mid-March timeframe, just like everyone else experienced when things went to the next level. We immediately set up our operational command center, our emergency command center, under those emergency management protocols. And that first couple of weeks, I would describe as controlled chaos. We were following those emergency management procedures, but it was just, by the minute, information was changing, facts were changing. Of course, at that time, we had no idea what to expect as far as number of cases that we might see and number of patients. So those first couple of weeks were, just making decision after decision with respect to what are our personal protective equipment levels, what procedures do we need to put in place to make sure our staff is protected? Are there existing policies we have that we need to suspend or modify to make sure staff is protected, make sure they're taken care of, protect our bed capacity? What are we going to do about elective procedures? That's something we may talk a little bit more about here in a little bit. How are we going to, balance the need to take care of the organization long term with taking care of employees who are immediately affected by the situation and losing hours if they were working in departments that were not going to be providing services for the short time. So all of those decisions in that first couple of weeks was just, by the minute, working many hours and trying to put those temporary policies in place. After 2 or 3 weeks, we really settled into more of a strategic mindset of, what are we going to do strategically to not only get through the next few weeks, but also use the current situation as an opportunity to identify ways that we can become a better organization when this is over. And so, we've continued to have daily administrative huddles related to COVID. We have a daily task force meeting that's broader than just our administration on COVID issues. The command center is still operational. We have weekly meetings with our medical staff leadership at all 3 of our hospitals to just make sure they're up to date and have an opportunity to ask questions, and that we're all operating from the same information and the same facts. So it has been, I would say, 90% COVID related work over the last 6 weeks. Very, very challenging, but also rewarding, and lots of good things that have come out of that from, our trust and collaboration with each other in leadership, with our medical staff, and using this as an opportunity in the middle of something that's so difficult, as an opportunity to find ways to be a better organization, both in the middle of this and permanently when this is over.
Yeah, and as being an elected official over here in Bridgeport, y'all sent us information regarding COVID-19, and obviously seeing a lot of information being put out on social media. And that has really helped us. Like you said, in the beginning of all this, it was kind of controlled chaos. And so that kind of helped keep us in line as far as decision making. And so we greatly appreciate all y'all's efforts in keeping us educated on everything. And so, yeah, that was really good for us over here. And so, well, regarding COVID-19, can you tell us how testing has been going for COVID-19 at the hospital and where y'all are currently doing it right now?
Yeah, I would say, Kevin, that testing is really the number one factor in determining our ability to be successful in this, not only at Wise Health System, but the healthcare industry as a whole throughout Texas and the nation. So at the very beginning, for the first couple of weeks, we really only had 1 or 2 labs that we were able to use for these tests. We would take the specimen and we would send those off. And that first couple of weeks, it was 7, 8, even as many as 10 or more days before we were getting those results back. And, I want to explain the detrimental impact of that delay. I know our numbers in Wise County, mid-20s for total number of positives. At Wise Health System, we may have had, I don't have the exact number in front of me, but somewhere in the 9, 10, 11 range of actual positive patients that we have treated within our facility. But that really does not tell the full story of how big of an impact this has had on our operations. And it's because of that delay in testing. So we have, if a patient is symptomatic and showing signs of possibly having COVID, and they need to be admitted to our facility, we do the test, but in that lag of waiting on those results, we have to treat them as if they are positive. And so what that means internally is we dedicated our entire 5th floor as our COVID unit. So patients who were admitted to the hospital who needed to be treated, either they had COVID or they needed to be treated as if they had COVID, were going to the 5th floor unless they were their sickness was to a level where they needed ICU care. And so then we dedicated half of our 3rd floor, which is our ICU unit, to isolated rooms, and we did some temporary construction to create some more isolation for those patients to keep them away from the general population. So even though the number of positive patients that have been in-house at any given time has not been too great, when we're waiting on those test results, the number of patients that we've had that we have to treat as if they're positive has been anywhere from 15 to 20 during most of the weeks that we've been in this, because we're waiting on those negative results. That's got a big detrimental impact because it's taking up beds that could otherwise be used for other patients. COVID situations require a higher staffing level, so there's more staff and nurses that have to be dedicated to that care. Personal protective equipment that's being used is much greater for those patients, and so it's a significant impact on operations, even though the actual positive numbers have been, fortunately for the county, have been lower than what you've seen in some areas. After that first couple of weeks, we had a contract with a company that we've used for testing in other areas in the past that had developed their own COVID test, and we launched our drive-through testing over in Bridgeport, I think about 2 weeks into this process, using that company. Unlike those first couple of labs we were relying on, this company had a quicker turnaround. They were able to get the test back to us within 2 to 3 days of us actually taking the test. Their lab is in Virginia, so we would take the specimen, we would send it to Virginia, and they've been very good to work with and have been getting results back to us in 2 to 3 days. After a few days of successfully using them at our drive-through testing, we decided to expand that particular arrangement to all of our testing within the hospital so that we could start getting them within 2 to 3 days, as opposed to that 8 to 10 days we were seeing with those original labs. We are continuing to use that company at our drive-through testing in Bridgeport. Our clinics, our physician clinics around the area use that particular company. And once we started doing elective procedures again, which I'm sure we'll talk about here in a little bit, once we started doing those again, we are testing all of our surgical patients. So they're going through our drive-through testing over in Bridgeport, or at our Argyle and North Fort Worth facilities. They actually do it at the hospital. All of those are going through that company to get those results back before those patients come into the hospital. So that's all still happening. Last thing that's important to know on testing, we do have the ability to do in-house testing here at our lab in the hospital. We have the equipment. It's a different company and a different test that we do for that. The problem is that it requires what they call cartridges that you have to use with that equipment to do the test. And each test requires 1 cartridge. So the first 4 or 5 weeks, we didn't have any cartridges. We had requested them. We were in line. As you can imagine, the demand for those cartridges is far greater than the supply. About 3 weeks ago, we did receive 30 of those cartridges. We determined, obviously, those are in high demand, and we did not want to use them for all of our testing. So we made the decision to only do that in-house testing for patients who come to the ER and who need to be admitted to one of the floors. And we would do the in-house test. That test actually allows us to get the results back in 50 minutes. So what that does for us is we get the test immediately, and we know before they even go upstairs whether they're positive or negative. So now if they're negative, we don't have to put them in those COVID units. We don't have to take up those beds and that extra staffing and that sort of thing. So 3 weeks ago, we got 30 of those tests in. We've been burning anywhere from 8 to 10 a day, even trying to conserve them and only use them for the sickest patients. That supply lasted for 4 or 5 days. So after that, we were back to waiting 3 or 4 days. So if you look at our internal numbers, when we aren't able to do the in-house testing, you will see the number of patients in our COVID beds increase to 15, 20, where we're having to do that. Whenever we're able to get those test results back in less than an hour, then those numbers go down to almost zero because we know before they even go upstairs what they are. Right now, we're in a really good situation. We did get 160 more of those cartridges in last week, and then we got another supply this week of about 150. So we feel like the supply is catching up to the demand on those, and as long as we can continue to receive those cartridges and test those patients and get those results back within about 50 minutes, then we're in really good shape upstairs on our beds and our staffing and our supplies. So that's where we currently stand on that.
Yeah, we seemed really good. Well, one, that's really great to hear that how efficient that testing has become. So y'all don't have to put them in an area where there's a potential COVID-19, or you can leave those beds available. But also too, the amount of testing that our county does for a population of our size, it seems like, comparatively speaking, we've done a really good job of actually testing people. And so I know Parker County, I believe they have a lot less than what we have right now. I don't know what the current numbers are, but as of a couple of weeks ago, they were a lot less than what we were doing. And so that's very fortunate for us here in Wise County going through all this.
Yeah, that's right, Kevin. Percentage-wise, for a county our size, we're way ahead of the game on number of tests that we're able to conduct. And I give a lot of credit to our emergency department staff and our emergency department physicians for creating a plan at the very beginning to start that drive-through testing over in Bridgeport. That really came out of our emergency department, and they created that plan and set that up. And now we've had staff working that location and staffing that really since about week 2. I think we had drive-through testing in place at least 2 weeks before they had any drive-through locations in Tarrant County. So really proud of our team for getting that established and getting that set up. And I'll comment on why that's so important. The more people that have symptoms or maybe haven't been exposed to a COVID patient, the more people that can get tested and determine as quickly as possible whether they're positive or negative gives you all that more time to isolate yourself, right, to trace back other people you've been in contact with and get them tested. So the ability to test and do a lot of tests is really important. And I think that's one reason we've been successful here in Wise County is the ability to do those tests.
Yeah. And I think, also too, getting out the information that y'all have been giving, and I know from the county and local levels, there's been a huge effort to educate people on the proper way to do things, and just either businesses or individuals. And so we've been a lot of good teamwork happening in the county. And well, you've kind of touched on it all through this, how y'all have adjusted as far as, can you tell the viewers how Wise Health System has adjusted to the from the mandates from the governor's office, if you will?
Yeah, probably the biggest one that has affected us is the determination on elective and non-essential procedures. Mm-hmm. Of course, like other businesses, we have been screening our anybody who enters the hospital. We had screening procedures set up almost immediately. Visitation policies was a big one that affected hospitals and limiting the number of visitors in our hospital. And so we still have, even though the state is gradually in the process of reopening, we still have all of those screening and visitation policies in place. The most significant impact on our organization relates to the governor's order on elective procedures. If you go back to the first couple of weeks in that controlled chaos period that we were talking about, that was the number one thing that we were looking at and considering on a daily basis, is whether to continue to do elective procedures. And I do want to be really clear on this, that I think patients who come to the hospital, it's probably one of the safest places you can be with the protections and procedures we have in place to prevent the spread and prevent exposure. We are still here to take care of your needs, and I don't want people to feel like we're just overrun with COVID cases and they can't come here if they've got a health problem that they really need taken care of. So when we were looking at elective procedures early on, it really wasn't so much, oh, we should stop doing electives because we need to prevent exposure or spread of our patients and people in the hospital. It had much more to do with the need to conserve beds, supplies, and staffing for what at that time we really didn't know what was coming from a COVID patient standpoint. And we were already seeing very early on of people starting to try to gouge us on prices with respect to supplies and that sort of thing. So on Friday, March 20th, we actually made the decision as an organization to suspend doing elective and non-essential procedures. We were going to make that effective on Monday, March 23rd. On Sunday, March 22nd, the governor actually made that decision and issued that order to make it statewide for nobody to do electives. And of course, the Texas Medical Board and others followed the governor's lead on that. So we had made that decision a couple of days before the governor made it for us. But then, of course, that had been in place until just a couple of weeks ago. That's had the most significant impact financially on us. But a couple of weeks ago, he decided to reopen electives if hospitals could show certain things with respect to bed capacity and PPE. So once he allowed us to do that, now we're 5-6 weeks further along. We have a much better understanding of what our numbers are looking like in Wise County, the number of patients that we're going to need. We've got our policies and everything established up on the floors. So we're in much better shape than we were in mid-March from the standpoint of making sure we have the beds and supplies and staffing necessary to take care of these patients. That when he released his order a couple of weeks ago, or issued his order releasing us and freeing us up to start doing some electives, we felt like we were prepared and in great shape to do that. We do have again, because this is all really driven by supplies and beds and staffing, we do have a committee that meets every day at 3 o'clock. They look at our levels and all of those things. They look at our surgery schedule for the upcoming 2 or 3 days, and we're making a daily decision of, are we in good shape from a supply and a bed standpoint to continue with the surgeries that we're doing? And so far, the answer has been yes every day that we've looked at that. If at any point we feel like we need to either scale back electives or either suspend them again, we will do that. But right now, especially with that in-house testing capability, we're in good shape to continue to do that. So those orders with respect to electives from the governor have probably been the most impactful on us.
And that's a huge thing too, to step back on or cut back on the elective procedures, because y'all are truly doing what's best for the community and not necessarily financially best for the hospital, because y'all are doing a really good thing there by doing that, because it's kind of at a self-sacrifice to the hospital.
Yeah, Kevin, appreciate you saying that. I think, especially early on, it may have improved over the last few weeks, but I think there was this perception out there in the public that while so many businesses were being harmed and impacted by some of the measures that we've had to put in place, there was this perception that if hospitals are being overrun, then hospitals might be the exception to that and doing okay financially. And, I can let you and your viewers know that nothing could be further from the truth. Where hospitals make their margins is not on, patients that are sick and are admitted up to ICU and on our floors. Often hospitals lose money on those types of patients. Where hospitals make money is on outpatient procedures and elective procedures. And so you're right. We made that decision in mid-March, knowing that it was going to significantly hurt us financially, but also knowing that it was the right thing to do to make sure as an organization we were prepared to take care of whatever may be coming over those next few weeks from a COVID standpoint.
Yeah, that's I guess the proof is in the pudding because of the measures y'all taken. We're in a better standpoint right now. Everything's kind of settling and everything's moving along. And so I know as a community, I thank you. And I know we as a community think what y'all are doing and the practices y'all are putting in place. And so, and also too, something you noted, supplies costs are going up too. Cause I know, like you'd mentioned the other day, some costs like for masks have gone up significantly as well.
Yeah, we, throughout this whole thing, I'm going to give, some big props to our supply chain team and our materials management department. They've done a fantastic job of making sure that our supply levels remained at least adequate. I mean, there's been days when we've struggled in certain areas, but not to the extent that we've seen other hospitals around the state or the country struggle from a supply standpoint. We have had to pay more than we typically would have to pay for some of those supplies. For example, N95 mask, that's something you guys have heard in the public quite a bit. That's been talked about a lot. Typically, prior to this, those would run us about 50 cents per mask. We have been paying as much as $3 to $3.50 per mask during this. I can tell you some have tried to charge us as much as $6 or $7 per mask, but we've been able to find suppliers in that $2.50 to $3.50 range. And our materials team has done a great job of really developing a good list of possible vendors, negotiating, working with those vendors. One of the things that when the governor issued his order allowing us to start doing elective procedures again, I had to certify to the state on a couple of different things. I had to certify that we would still maintain a certain percentage of our beds for COVID patients. And I also had to certify that if we decided to start doing electives again, we would not request PPE from any federal or state source as long as this pandemic lasts. And because of the efforts of our supply chain team, I felt very comfortable making that certification. The vast majority of the supplies that we have received during this have come from our private supply networks. We'd received very little from those public sources anyway. And so it gave me that confidence to go ahead and make that certification and start doing it again. And to their credit, they have been maintaining those all of those at adequate levels throughout this entire deal.
That's great. Not the pricing, but the ability to keep everything in stock. And so I got a great team over there. My next question is kind of moving forward and moving ahead. Does the healthcare system believe there could be a second wave in the future?
I think that's certainly possible. Some of the science and data supports that. I've said this several times in different community settings over the last several weeks. To me, and I think it's important for everybody to remember that this never was really about the disease itself. I mean, we want to protect our vulnerable population and we need to do that, but there's not anything that's really unique about this disease and how it impacts us that's significantly different from other things like the flu. The main difference is that it's novel, that it's brand new. And so we don't have vaccines. We don't have immunities that have built up in the general population. And, there's certainly an argument that the disease needs to run its course so that those immunities and things can develop. And that's right. And I agree with that. The problem is the capacity of the healthcare system to take care of those patients when they get sick. We have the capacity to take care of flu patients because we know those numbers are not going to overrun us because we do have vaccines and we do have immunities that have built up. When it comes to this, that has been the fear all along. And to me, that's really what was driving the need for social distancing from the very beginning. So at this point, we've learned a lot. And at least in Texas, I think the hospital system has prepared well and is in a position where we have been able to handle those numbers so far. And I think that's why the governor feels comfortable starting to gradually reopen the state. I do think there's a possibility as we start to reopen that there may be future surges. You can find different data out there, but I don't think it's incorrect to say that over the next 18 months to 2 years, we may see different surges until we have those immunities that have built up and those vaccines. But I'm also confident, knowing what I know today about where we are, both at Wise Health System and as a hospital system in Texas as a whole, that I think we'll be able to handle that.
And that's what everybody's talking about, the flattening of the curve, to make sure if we have that huge spike, then we're going above that line where y'all aren't overwhelmed. So you want to stay below that line to keep y'all from being overwhelmed. And that's why we're doing all the social distancing and all that.
Yeah, that's exactly right. We've all seen the different curve graphs that have been out there over the last several weeks. And so if you imagine one of those graphs that you're familiar with, just imagine a straight line somewhere across that graph, and that line is there you go. How many very sick people can hospitals treat? So as long as we can keep that in the yellow, and so far in Texas we have been able to do that, then we're in good shape. It's when it becomes in that blue area that it really becomes a problem. States like New York, New Jersey, the New Orleans area, Washington State, they have not been able to keep it below that hospital capacity line, and that's where they've run into the problem. But in Texas so far, we've been able to do that.
We've seen to be doing as a state a really good job of that, and probably part of that is because we're so big and we're so separated as well. Like the major metropolitan areas are really separated. Like El Paso's on one side of the state, Houston's down there, and DFW's up here, and obviously Austin in the middle, down there. But we're pretty spread out, and so that might be helping us as well.
Yeah, I think there's a couple of reasons why we've been successful here. One of them is just that we don't live on top of each other like you do in other parts of the country. Our cities are further spread out, and even within the state, where there's just a lot of spacing that naturally occurs with a big state like Texas that you don't have in some other areas. And then the second one is timing. Really, we all, our entire nation woke up to this at the same time. And the social distancing and measures that were put in place about the same time in New York as they were in Decatur, Texas. The difference is that by that point in New York, the disease had already spread, being a port of entry and just the population there, it had already spread quite a bit more than it had in Texas. So we had a little bit of advantage of time to prepare and react that they didn't have in some other parts of the country. And that, along with that spacing, I think are a couple of the main reasons we've been so successful here.
Yeah. In light of the new guidelines from like opening Texas, can you tell viewers the perspective from the healthcare system, our path forward, I guess?
Yes. Relates to some of the things we've just been talking about, but going back to what I believe is the fundamental premise. I've monitored the debate that's been kind of going on in our nation and even in our county over the last 2 or 3 weeks of, was this an overreaction? Do we really need all of these measures? I will tell you from a healthcare perspective, I do not believe it was an overreaction. I think it was absolutely necessary and proper. I think the success that we have had is because a lot of these measures were put in place. And again, as I mentioned a few minutes ago, it's not because of the disease itself, but it's because of that hospital capacity line and the ability of the healthcare system to take care of it. I think we do have to balance that with the harm that's caused by shutting down an economy. I mean, there's no question that that people are affected by that, and there's harm in both of these things. So it's our job to find the right balance of trying to make sure we're taking care of both of those sides of that equation. As we start reopening and as we move forward, I think the governor's plan is appropriate. And I think it's appropriate because it is a measured, gradual, phased in approach. I think it would be problematic if you tried to flip a switch and just go back to the way everything was before this. So I appreciate the gradual approach that he's taking to this. I think everybody needs to remember that it's up to us to implement it that way, and not just rush back to having everything normal, because if we do that, when those future surges come, it's possible that we could go above that hospital capacity line on those graphs, and that's what we're trying to avoid. So I think it's absolutely necessary to start trying to reopen the state and get people back to work and not let this linger any longer than possible. But I also think it's extremely important from a healthcare perspective that we do it in a phased and gradual and measured approach, and really pay attention to the details of the governor's orders. And by all means, go support our local businesses and go buy locally and shop locally. And when you have needs, let's go take care of each other and do that. But if you don't have a reason to get out, the social distancing is still very important and needs to be followed, at least for the immediate future.
Absolutely. Yeah. And it's been good seeing a lot of folks. Like I said, we went at the beginning of the show, we went out shopping this morning for groceries and things. And a lot of people are wearing masks and following the social distancing. Even we went to Walmart this morning, and people were paying attention to going down the one-way aisles. And it seemed to be, I think all the puzzle pieces are coming together for a positive thing. And if people keep following that, then the measured opening will be successful, I hope, while keeping numbers at a minimum.
Yeah,
and so
I hope
hopefully
so too.
that'll continue.
I think we can accomplish both.
I do too. Yeah. Has our healthcare, well, we've already talked about the financial aspect, but I know folks are doing things to conserve N95 masks, so healthcare workers can have appropriate personal protective equipment. And that's what, when we say PPE, that's what we're talking about, personal protective equipment, in case those out there are not certain what that is. Can you tell folks about the supplies that are going on, and if someone wants to donate a N95 mask, do they have that ability, be it the cloth or the N95 or whatever out there? Because I know a lot of people are donating to healthcare workers and the hospital systems.
Yes, they do. And, I said early on that as challenging as this situation has been, there's also been just so many positive and rewarding things that have come out of this and that I've seen. We live in a great county. We've known that for a long time as to how supportive this county is and how much we take care of each other. And, I want to say to everybody that's listening how grateful Wise Health System is for your support and your donations. We've just been overwhelmed by the community's generosity toward us and our staff and our workers in the middle of this. We have received a number of donations of supplies. And yes, we like to coordinate that through our supply chain department. People can feel free to reach out to me, or I see the main number that's scrolling across the bottom. They can contact us through our website or through that number, and we'll make sure they get in contact with our supply department to arrange those donations, because we obviously want to include those in our overall counts and make sure we understand the levels. So yes, we're very appreciative of those. And if people have ways to donate, then we would like to hear it. Another thing that we've done is we continue to add to our list of possible vendors. So I know a number of people have emailed me and said, hey, I've got a friend that, they've got a manufacturing plant in Texarkana, and they've revamped that plant to manufacture personal protective equipment instead of whatever product they used to manufacture. If you send me that contact information, I get it to our materials department. They will add it to their list and use that as a place to coordinate potential future purchases. Food is something that people like to donate, and
Yeah.
that has been very much appreciated and received well by our staff. We do have a couple of people that are coordinating that. Our patient relations department is the group to contact for those that want to make food service donations. Obviously, we still have visitation limitations here, and we're still screening, so we can't just have people coming in and bringing it. So we do have to have a coordinated effort on that, but there are ways to do that for those that want to make that donation as well. And we are just extremely appreciative of the support that we've received.
Yeah, and you see it all the time on Facebook. People coming up there and donate food and some, masks or whatever they have they can donate. I do know there's a financial donation aspect to this as well with the foundation and everything like that, because that they do a lot of good work over there. Is it if someone were to want to donate financially to the hospital to help support or what have you, is there an avenue to go to do that?
Yes, there is, Kevin. That we're accepting those through our foundation. It's Wise Health Foundation, and the foundation has its own website that you can find. If you search that, I would tell you exactly what it is, but I don't have it off the top of my head. But it's Wise Health Foundation, and I mentioned earlier the premiums that we're having to pay right now for supplies and that sort of thing. People have been donating to the foundation and designating those funds for COVID-related expenses. So the way that works is, we're tracking all these additional expenses that we're incurring right now related to the COVID situation. And we will be able to use those funds that are donated to our foundation and designated for COVID to cover a lot of those extra PPE costs and things of that nature, testing and the cost associated with that. We'll be able to use those donations to the foundation for that. So I know a number of organizations and people in the county have made those donations to the foundation for that purpose, and we're so thankful for that, and hope that people know they have that opportunity there if they would like to do that.
Well, I sure thank you for coming on the show. Is there anything we've kind of talked about, social distancing, the importance, the flattening curve, and everything. Is there anything else that you want to tell the viewers right now that we may not have discussed that you think might be important for them to know before leaving here today?
Kevin, not that I can think of. I think the questions have been thorough and we've covered most of it, but I will take the opportunity to again just say thank you to you for having me on and letting me talk about these things, but also to the community as a whole. The pep rally that we had where you guys were cheering on the first responders and the nurses and techs and everybody at shift change a few weeks ago, everything from that to these food donations and the monetary donations is just yet another reminder of how fortunate we are to live where we do and be in a county that loves and supports each other the way this county does, and makes me very thankful and grateful to have the job I have where our main job is to take care of this county, and it certainly makes it easy to do that whenever I see the response and the overwhelming support that we get in a situation like this. So I'll just end it by saying another thank you to everyone that's been involved in those things.
Yeah, and like you said, it's great. This county has been really outstanding, and the way that everybody has kind of handled this, and y'all are being the healthcare system of the county, y'all have done an outstanding job. Well, Jason, I sure appreciate you coming on and telling all that information to our viewers here, and I know that I greatly appreciate it, and I know the community greatly appreciates what you did today. And not only that, I know we all appreciate what everybody's doing at Wise Health System, all the healthcare providers there, the nurses, staff, everybody that's associated with Wise Health System, and even the doctors throughout the community. That's basically the front line of this, and y'all outstanding job battling it. Can't thank y'all enough.
Thank you, Kevin. We appreciate it. Thank you again for having me on.
Oh, absolutely. Thank you for your time. And I know you're busy, but again, thank you so much. And you take care and have a great day.
Thank you, Kevin. You too.
All right. Talk to you later. Well, that was Jason Wren, President CEO of Wise Health System. That was a lot of great information. I can't thank him enough for taking the time to come out here and talk to the viewers today, and about everything that's going on with Wise Health System. And our healthcare system, it can be, we got to take care of it. It can be fragile, and so it's in opening Texas up. We got to do our part and not overwhelming our healthcare system by following the guidelines and everything like that. Well, moving along to our guest of the next guest is for the business of the day. It's Stefany Jones, owner of Halsell Street Boutique. She's going to come on here. I'm going to bring her up.
Hello,
There she
hello.
is.
How are you?
Hey, Stefany, how you doing today?
I'm pretty good, honestly. It's been a really good day. Not too crazy.
Yeah, well, thank you for coming on today, and
Of
I
course.
can't
Thanks
wait
for
to hear
having me.
about all the things that you have going on. Oh, absolutely, anytime. Well, I guess we'll get right off into it and ask the first question. Can you tell folks about Halsell Street Boutique and Resale and what your establishment offers to the customers?
Yes. So we're a little bit different than just like your average boutique. So I am 50% new, 50% resale. So if you like to go thrift shopping or, things like that, or you don't want to pay full price for stuff, definitely come check me out because I do have thrift stuff, but I do also have people that, don't want to go through thrift items, which I totally understand, especially with everything that has been going on. So I do have new options as well. But I will say that I have a washer and dryer in the back. So everything that I buy that is resale, I always wash it, clean everything. And we do also sanitize everything. We always have. That's why it doesn't smell like a resale store in here because we take those measures. And we've been doing that since all of this Corona stuff happened. So we've been doing good.
Well, that's good to know that you take that extra effort to go in clothes and wash them and have them presentable when they're on the rack and everything. And I've been in there before. It's a nice shop, and there's a lot to offer there. And I can't wait till where y'all are able to reopen and folks can go up in there and.
Sorry, I just said I was so excited. I can't wait.
Yeah, I know, and y'all are going to be opening up pretty soon. I didn't know if you want to talk about. I know there's certain mandates that are happening,
Yes.
and certain businesses can open up. When are y'all planning to open up to allow customers to come in?
So we are allowed to open up right now, but I'm a little hesitant just because I feel like there's going to be a second wave. I don't want to be a negative Nelly, but I just feel like there's going to be a second wave, and I'm just going to hold off. So we're going to be reopening May 26th, the day after Memorial Day.
Okay, well that's something really to look forward to then. I know a lot of folks are going to look forward. I know a lot of folks like shopping in your establishment. I know a lot of folks will be looking forward to that. Question would be, can you tell folks how y'all have adapted to the mandates? I know y'all been closed down, and so y'all have had to find other ways to cater to customers.
Yes, sir. So it has been a little challenging, I will say, but our customers, they're fantastic. And even though we are not offering store pickup, I know it is a big inconvenience because a lot of my people do live in Bridgeport or in Wise County, and they're like, well, I don't want to pay shipping charges. I totally understand that. But the best part about me is I make no money off of shipping at all. So all you guys have to pay is the bare minimum. So that's whatever it weighs. And it's usually only like $2 to $9. It just depends on the weight of the item. And I know that it is just a little, it's not that much money, but you're still obviously losing money. But with other boutiques, it would be $25 to $50 with shipping. So we try to take care of you guys. And I don't believe in making money off of shipping. I just think that that's silly because I've been on live sales and like I bought 10 pair. I bought 5 pair of shoes and then they charge me $50 in shipping because they charge $10 for each pair of shoes. I can't pay $50 in shipping. That's crazy. So that's the main reason why I do it. It just seems outrageous to me personally.
Well, that's great of you, and that's kind of one of the ways we've had to adapt and overcome this situation. And that's an outstanding And
Oh,
so,
and we've been doing live
that's,
sales as well. So we do live sales on Facebook. I
mhm.
do one every single Tuesday at 6 p.m. Y'all should come check us out. And during those live sales, we do awesome things. So if you share the live video, your name gets put in a drawing and you'll either win $10 store credit, you'll win earrings, accessories, all kinds of stuff just for sharing the video. And then if you purchase anything, you get put in another drawing and you might win a bigger item, like let's say a purse or a pair of shoes or something like that. So they are really, really great. And people ask me all the time, are live sales worth it? 1000%. Because even before this whole pandemic thing happened,
Yeah.
there was days when people wouldn't walk in here because obviously they have a life, they have things going on. I totally understand. And so my live sales could sometimes make my entire week. So the live sales are definitely worth it. And plus they're a lot of fun. You get to meet a lot of people and it's a really good time. I always tell people to come and check us out because you never know. You might win stuff just for sharing.
Absolutely. I've seen, I caught a couple of your live streams and they're really fun. And I suggest anybody and everybody to go and view your live streams. They've been very popular. You got quite a following, and y'all offer great products there. It's not just resale. Y'all offer some new stuff there too. It's kind of a mixture of things, and
Yes,
whatever your taste is in clothing and stuff like that. That's an outstanding way to shop at your shop, and you do a great job there.
thank you. It is crazy, but I do
The
love
next, oh,
it. It's great.
what's that?
I said it's crazy and it is madness all the time and I'm never organized, but I really do love my job. It is so much fun. And the community of Bridgeport, that's why I chose to put my store here, is just because of the people. They are fantastic. It is still that same hometown feel. I mean, anytime I'm carrying in boxes, racks, anything that is clearly bigger than myself, it doesn't matter if I know the person that's outside or not, they will stop and ask me if I need help. So Bridgeport is the place to be, you guys. It is. The people here are fantastic.
Well, we appreciate you being here, and it offers a way to shop here locally, and we don't have to drive to the Metroplex to get some good clothing. And so, and when we're hunting for Mother's Day coming up and all that, we have the ability to shop locally. And
Yes,
so, anyways, how can we've been talking about all that? How can customers get in contact with you or follow Halsell Street Boutique and Resale?
So yeah, you guys can either follow us on Facebook. It's just Halsell Street Boutique and Resale, like what is typed below my face right here. You can also check us out on Instagram. That is just Halsell Street Boutique. And I mean, I post at least once a day. I try not to post more than that because, it can get a little annoying and repetitive, I will say. But I post all the time. I try to keep you guys informed. I let y'all know whenever, I send out invoices out and things like that. So mainly just Facebook. We do have a website, and that is halsellstreetboutique.com as well. But right now, it's kind of, I'm trying to get it all up and posted and everything, but I am just not a tech savvy gal. I'm trying to learn the ways of the internet, but it is just not my forte. So it is taking me a little bit more time than I anticipated. But we are definitely working on that. And you guys can check out our website. But Facebook is honestly the best way to go because the live sales, it's just fun. It's interactive. You meet people you would have never thought. I mean, I have ladies up in New York, Connecticut. I have one in South Dakota, just random places that you would never think that people would shop, but they love it. And they especially love, I've noticed that all of my quote unquote Yankee customers, they all really like the Western wear and they buy it from me because they're like, you're in Texas. It's authentic. Like I trust you because I know it's the real deal. Whereas, if they were to get it from, let's say New York, it wouldn't be as quote unquote authentic.
Yeah.
So it's very interesting.
It's like buying hot sauce up in New York City. It's just not the same thing.
Exactly. Or Mexican food, it's just, it's not the same.
Yeah. Well, I can tell you what, you can't tell that you're not tech savvy because you got all kinds you got book, a website, other ways to access you and to watch the live stream. So you do an outstanding job there.
Thank
Stefany,
you.
can you tell us, I know we've kind of discussed a lot of different things, but is there anything that we haven't discussed that you'd like to tell the customers about? Do you have any sales or specials coming up?
So people always ask me about sales and things like that. And just to be completely blunt, I'm not a very, how do I word this? Okay, just to be completely blunt, I don't put enough money on things to put them on sale. I'm a very fair person. So like, just for example, if I like buy something for $7, I'll usually only put $7 or less on it. So I'm not timesing it by 3 or timesing it by 4 like most establishments do. And that's why we have such reasonable prices. So it's kind of hard for me to put this on sale just because, and I will obviously make no money at all. But that's why people like shopping with us because, there are amazing boutiques in Wise County and outside of Wise County. And just for example, there's boutiques in Azle. And yes, I have the same top as they do, but I'm $6 to $8 cheaper. So then people will buy with me because if they're buying, 10 items and you can save $8 on every item, that's $80. Why would you not? But I will say,
yeah, exactly.
I will say that one good thing is that anything you guys buy with us, y'all have 30 days and you can return those items, whether they are new or thrift, aka resale. You can return those items as long as the tags are on, and I give you your money back. I don't know any other establishment any other boutique that actually gives you your money back. Everybody does store credit. I do not believe in store credit. I hate it. There's been so many times where I've gone to return something and I never went back. It was literally just money gone. So I don't believe in store credit. I give you guys your money back, but y'all only have 30 days to do so. But that's another really good thing, as well as we don't make anything off of shipping. We don't have one set style. I have hippie clothes. I got Western. I got preppy. I have urban. I have something for everyone. And we have sizes extra small all the way to 3X. So we have something for everyone. And I really do enjoy it. And I find that people come in here and they like it because it's not just one set style. And, it's a lot of fun. It really is.
Yeah, and you made a really good point that for folks, it's such a great place to come shop locally because it's priced very well. Because by the time you drive to the Metroplex and then pay the marked up prices, because you can go to some of them larger retails and there's always like a sale, and it's still because they've
Very
marked
expensive.
the prices so way up. And so, but to have those very, very reasonable prices at your establishment, plus you talk about fuel and everything else, it's a savings coming to you and shopping. And you'll have great products there. And I know I've shopped there for my wife and my daughter on occasion, and they've always loved whatever y'all have there. And so,
Awesome.
Well, Stefany, thank you so much for coming on the show, and I appreciate your time. And if there's nothing else, I'll thank you for coming on the show. And
I did want to do my little plug real quick. So again, you guys, we are reopening May 26th. So y'all come in. We are open Tuesday. Oh my gosh, I don't even know my hours because I've been closed so long. Oh my goodness. We're open Tuesday and Wednesday, 11 to 5. And then Thursday and Friday, we are open 11 to 7. And then Saturdays, we are open 10 to 5. So starting May 26th, y'all come in. Again, anything you guys buy with us, y'all have 30 days to return and you get your money back. I make no money off of shipping. Whatever it weighs is all you guys have to pay. I'm trying to see if I left anything out. No store pickup, shipping only. And yeah, y'all should definitely come in and whenever we do reopen and hang out, and we do live sales on Facebook every Tuesday at 6. I sometimes do them on Thursday as well. Like this week, I am having another live sale on Thursday because I didn't show everything on Tuesday. So y'all definitely come and check us out. And yeah, I'm super happy. Thank you for having me. I do appreciate this. You definitely did not have to reach out and let me be a guest. So I feel very honored and I do appreciate this. And, it makes a difference doing little things like this. So I appreciate it. You have no idea.
Well, you're welcome, and this is all a community thing and a community effort. You know, if y'all weren't coming on, this wouldn't be happening. And so this is y'all have supported our community. Local businesses like yours have supported our community during the good times. It's you know, we have a responsibility, and I, I just feel it's something we should do, that we should help support our local business in y'all's time right now when y'all may need a bit of help keeping going till the backside of this thing. And so I appreciate you investing in Bridgeport and being a part of our community and bringing a shop here. And so be sure to go to Halsell Street Boutique, contact her by phone, do the live stream. It's really fun. And you might win something if you go on that thing, go on the live stream. And that's, yeah. And so, but Stefany, thank you so much for coming on, and take care and stay safe.
Thank you, Kevin. I hope everyone has a good day, and hopefully I will be seeing y'all next Tuesday. Bye, y'all.
All right. See you then. Take care, Stefany.
Bye. See ya.
Bye. See ya. Well, that's Stefany. Stefany Jones, owner of Halsell Street Boutique and Resale. Can't thank her enough for coming on today. She's got a lot of great products. Mother's Day's coming up, and so she's got a lot of great things in there to buy for your mom and or wife, for the kids and stuff to buy for Mother's Day. And so I highly suggest y'all go in there or check her live stream out to be able to shop on her from her establishment. Jason Wren coming on, President and CEO of the Wise Health System. A lot of great information as to how our healthcare system is holding up and what they're doing and testing and various other things within as our Wise Health System here in Wise County. And so greatly appreciate his time for coming on today. As we touched on throughout his interview, it is highly essential right now as we're opening up Texas to continue social distancing and maintaining that 6-foot distance when we're out in public. And really kind of, you know, obviously go out to support local businesses, but also keeping to essential things and trying to keep socially distant from folks. Wearing masks, that's really important, because not only does it protect yourself, but it protects others in the case that you might have it. And so washing hands for 20 seconds, gloves if that's something that you're interested in doing. I see a lot of people doing that as well. And so been really proud of our community. We're doing a lot of great things. When I say a lot of great things, we're working together as a community to get through this. And we seem to be adapting to this situation, and we're going to overcome it. And so, but I invite all to view Friday's live stream with our guest being Steve Stanford, Bridgeport Police Chief. He's going to talk about some things going on with the police department. And then Kristen Howe, she's the CEO of Children's Advocacy Center for Denton and Wise County. And the business of the day will be Pronto's, our Italian restaurant here in Bridgeport, Texas. Also, I'm kind of throwing it out there now. If you are a business and interested in coming on the show to advertise your business during these times, I'd love to have you on. You can message me on Facebook, and I'll get back with you, and we can get you scheduled on. And so the business of the day is to help those local businesses get their name out there, advertise, so that they can create a little bit more business during these times and until we get back to a normality. I say it every show, we will get through this because we will. And we are in this together. We will combat this together. Keep calm and stay Bridgeport strong. Take care, everybody, and stay safe.